This is One-on-One. Dr. Michael Harris is co-director of the Institute for Pediatric Cancer and Blood Disorders at the Joseph M. Sanzari Children's Hospital. Good to see you.
Thanks for having me, Steve.
When a child has cancer, what happens? How challenging for you and your colleagues, but more importantly for that child and his or her family?
I think one of the most difficult days I have on any given day would be when I have to tell a parent that his or her child has cancer, because the whole world is altered. And I remember once very clearly, I was speaking in this tone of voice to a parent, and she said, "Stop shouting at me." And I realized immediately that my words increased hundreds of decibels because I was telling them that their child had cancer. So it is a very difficult day. However, at the same time, we know that we cure more than 80% of children with cancer. So although cancer remains the leading cause of death outside of accidents for children up to the age of 19, we certainly cure many more children than we used to. But yet, when one child dies, a whole universe is destroyed. So we have a tremendous responsibility to try to cure that child and to use the most cutting-edge therapy to get that child to be able to live and live a very fruitful life.
Doctor, let me ask you this. There are so many different forms of cancer. What are, if I can ask it this way, and if it's the wrong question, you'll tell me, are there certain forms of cancer that are more likely to affect children than others?
Excellent question. Children have a different category, if you will, of cancers that affect them than adults. Adults get tumor cancers of linings, you know, the GI tract, the breast, etc. Children get cancers that affect more or less the soft tissues, such as sarcomas, such as muscles, or the tissues that surround the muscles, the brain, which is the most common solid tumor in childhood, and the most common cancer we see are the leukemias, acute lymphocytic leukemia, followed by acute myelocytic leukemia.
What does that mean?
So the lymphocyte is a cell in the bloodstream that can become cancerous, and the myeloid cell are the neutrophils that help fight infection. That's a different type of cancer. So but leukemia, of course, is a cancer of the bloodstream or the cancer of the bone marrow, where the cells are made. And that, by far, is the most common type of cancers we see. It makes up about 40% of our cancers.
The most treatable forms of cancer, pediatric related cancer, are?
Well, the first are the leukemias, especially acute lymphocytic leukemia, which is that one category of leukemia where we cure over 80%, probably close to 90% of those children are now cured. Tumors of the kidney, such as Wilms tumor, we cure the overwhelming majority of those children. Hodgkin's lymphoma, non-Hodgkin's lymphoma, we cure the overwhelming majority of children. The most difficult cancers that we have to cure are the brain tumors and tumors of what we call the parasympathetic nervous system, which are neuroblastomas. Those are very difficult to cure, but we continue to increase our cure rate. So as time goes on, we hope to be able to cure more and more children like
Doctor,
that.
you told our producers in a pre-interview that you really cannot simply treat the child when it comes to pediatric oncology, that you must treat the entire family. And not exactly sure what that means.
As I said in the beginning, when cancer hits, the whole family mechanism is uprooted.
But how do you treat the whole family?
So how we treat the whole family is by having a very strong psychosocial support system. So we have social workers, we have child life who deal not only with the children and get into their hearts and minds, but also deal with their siblings. We have a psychologist, neuropsychologists who are able to evaluate what we are doing to the children.
But you can't, excuse me, Dr. You can't force the family to do it, but do you encourage them by letting them understand that even if they don't understand or initially say they don't want it, that it is essential?
That is a fantastic question, and thank you for asking that.
Because they may resist, I don't know.
You're absolutely correct. Some families will resist. They say, we can do this. We don't need to be here. After all, we're very strong. We're a strong family.
Do they have any idea what they're going to face?
That's right. So those families we monitor very carefully, and when the time is right, we then introduce our social workers, our child life people. They're introduced on day one, but then they may push them away. But they're always there to be able to step in. And very often, those families, and they're the minority, the majority willingly accept the support systems that we're going to give them. But those children who come from families where they resist, we wait, and the majority of those families finally come around and accept our services.
There's something called Cure and Beyond. Give me 30 seconds on it. What is it?
Cure and Beyond is our program for childhood cancer survivors. It includes not only the children, but I must admit, adolescent and young adults. The oldest person I am seeing now, child, is now 50, 51, too.
Right.
We call them the boys. They come every year. So it's a program that deals with the long-term effects of cancer therapy and the cancer itself. So we monitor these individuals, and we're not internists. Please understand that. What we do is we basically become the captain of the ship that finds the right services for these individuals who are suffering from long-term consequences of the cancer.
30 seconds. As challenging as your work is, very rewarding?
Extremely rewarding. Even when a child dies, which is a tragic situation, it certainly has affected me over the years. Just ask my wife and she'll tell you how it has affected me. But we gain so much from these individuals. And those children who are cured, they keep on coming back to us, and I see their families, I see their children. That is fantastic.
Doctor, I want to thank you not just for being here, but much more importantly for the work you do every day. Thank you.
Thank you ever so much, Steve.
One-on-One with Steve Adubato has been a production of the Caucus Educational Corporation, celebrating 25 years of broadcast excellence. Funding for this edition of One-on-One with Steve Adubato has been provided by the Russell Berry Foundation, Caldwell College, the Fidelco Group, Fedway Associates, New Jersey Sharing Network, Kessler Foundation, and by the Healthcare Foundation of New Jersey, founded by the Jewish community. Transportation provided by Airbrook Limousine, serving the metropolitan New York, New Jersey area. One-on-One with Steve Adubato has been produced in partnership with St. Joseph's Healthcare System.